Hello, I'm going to describe for you today a woman's options for parenthood after cancer treatment. First, I'm going to describe the structures involved in reproduction, then discuss some of the factors that can influence your risk for infertility after cancer treatment, describe how treatments actually affect fertility, and then finally spend most of the time talking about the options available for you to become a parent. So first, the structures of reproduction. Here you can see the vagina, which is where the penis penetrates during intercourse. The back of the vagina is the cervix, which opens up into the uterus. The inner lining of the uterus is called the endometrium, and here are the fallopian tubes and the ovaries. Now, the outer part of the ovary, called the cortex, is filled with follicles. These are little sacs, each of which contains a single egg or oocyte. Most of these eggs are dormant or in a resting phase, but once a woman reaches puberty, each month a few of these eggs will be recruited to mature. And here you can see images of maturing eggs, and as the eggs mature, the follicle or sac gets larger. Now, ovarian reserve is a term we use to describe the number and quality of eggs a woman has. At birth, a girl is born with about 1 million eggs. But as we get older, these eggs naturally break down, and so the number of eggs diminishes as we age. In fact, at the time of puberty, before a woman's had a single ovulation, the eggs are down to about 300,000, having lost about 2/3 of the eggs. When a woman reaches about 38 years of age, she has 25,000 eggs, and once the egg count goes to about 1,000, this triggers the onset of menopause when a woman no longer menstruates. Now, we can evaluate the ovarian reserve in a number of ways. One way is doing a transvaginal ultrasound. This involves placing a probe, which is about the size of 2 fingers, into the vagina. The probe emits sound waves which bounce off of the structures in the pelvis to create pictures of the ovaries and the uterus. And here you can see the image of the ovary, and these little black spots in the ovaries are follicles that are enlarged with developing eggs. And we can count these developing follicles or eggs. It's called an antral follicle count. Another way of evaluating ovarian reserve is through blood tests checking hormone levels. Some of the hormones we look at are AMH, FSH, and estradiol. Now, ovarian reserve testing is not exactly precise. No one can tell you exactly how many eggs you have in your ovary at any one time, but it can help predict the likelihood that you could become pregnant. So now I want to briefly describe what's involved with the menstrual cycle. Now, at the time of puberty, hormones are released from the pituitary gland in the brain. These are FSH and LH, and here you can see how the levels rise and fall over the 28-day menstrual cycle. Now, these hormones have an effect on the ovary. They stimulate some of the eggs to mature each month, and then on day 14 of the cycle, a single egg matures and is released at the time of ovulation. Now, there are also hormones released from the ovary during the 28-day cycle, estrogen and progesterone, and these in turn act on the lining of the uterus. They cause more blood vessels to develop in the endometrium, causing the lining to get very thick. And this is to prepare it for an embryo to implant, so that lots of blood supplies in the area, bringing oxygen and nutrients that a growing embryo would need. Now, if there's no pregnancy, these hormone levels drop off, and the lining of the uterus sloughs off, and that's seen as bleeding, and that's menses, or the beginning of the menstrual cycle. And so day 1 of bleeding begins the cycle all over again. Now, at the time of intercourse with the penis penetrating the vagina, the sperm actually swim up through the cervix, through the uterus, and into the fallopian tubes. Now, if this occurs around the time of ovulation, when the egg is released from the ovary, when the egg gets up into the fallopian tube, the sperm will fertilize it. The fertilized egg then drops down through the fallopian tube into the uterus and then can implant on the uterine lining, the endometrium, on about day 8 or 9. And that actually is the beginning of pregnancy. The uterus then is very elastic and it can expand to accommodate the growing fetus, but at the same time, the bottom part of the uterus, the cervix, stays closed to prevent an early labor.